Next, come to discussion about this cervical intraepithelial neoplasia. So these are the precursors of the cancer cervix. So when to intervene and where to intervene and what are this CIN. So these are the a group of different intraepithelial lesions with cytologically and histologically different from the normal. And it doesn't possess all the criteria of the malignancy. And they are grouped under the banner of pre-malignant lesion of the cervix. And incidence is about 4.9 to 6% cases. The CIN is now by Richards 96 classified into CIN1, CIN2 and CIN3. CIN1 is mild dysplasia where the basal part of the cervix is involved, 1/3. Moderate dysplasia is basal, 2/3 is involved, and severe dysplasia, that is called carcinoma in situ, more than 2/3 of the whole epithelium of the cervix is involved in this. And these are all squamous epithelium lesions. So you can see the various grades of CIN in this. I try to make you understand with this diagram. What is CIN1, CIN2 and CIN3. So first let us see the normal one. So this you are seeing the normal squamous epithelium. So this is only one lining and these are all the columnar epithelial cells. So if you see for the CIN1, most of this glandular epithelium or the columnar epithelium is replaced by the squamous epithelial cells. Okay. And in the CIN2 also, there is less glandular epithelium, more of the squamous. CIN3 all is occupied with the squamous epithelial cells. And in the carcinoma, invasive, everything is involved in that. There is nothing in the outside also, it has come. So this is called invasive carcinoma. Hopefully, you will understand with this diagram easily what is normal, what is CIN1, CIN2, CIN3, and this is invasive carcinoma. So mild, moderate and severe CIN1, CIN2 is also called dysplasia. So as you see, this is collectively called as a dysplasia. So how the CIN1 and CIN2 is called dysplasia and CIN3 usually falls in half dysplasia or in some cases it may be carcinoma. So how to progress with this we have to know. Next we will know. So natural history of cancer cervix usually you see first the inflammation will happen. Then when you do the pap smear, mild dysplasia will happen. This is called CIN1, which usually regresses. Then moderate dysplasia happens. That is called CIN2 in 1 to 6 years. It happens in 40% of the cases. Severe dysplasia is called CIN3 and carcinoma in situ is also called severe dysplasia. So it is which leads to the invasive carcinoma. Hopefully, I feel you have understood how it progresses from normal inflammatory stage to the invasive carcinoma. The etiology of this CIN carcinoma in situ is same as the cervical cancer, which already I have spoken regarding that. Next. So how to diagnose this type of CIN1 and all that. So we talked about the pap smear. Now when suppose pap smear has diagnosed that this is a dysplasia or this is a CIN, then how to proceed the next. So next level of instrument is called Colposcope, which is a OPD procedure, and this is an instrument where we can see identify the abnormal lesions by a binocular vision. So what are the pictures which I was showing you before about the normal cervix and the abnormal cervix are taken through the colposcope only. So easily we can correlate. So we have two agents like Lugol's iodine and acetoacetic acid, where these lesions will be stained and we can better identify it with a colposcope with a magnification of these views. And clearly we can take a biopsy from there. Here with the colposcope also the transformation zone is easily visualized. And it can during the colposcopy also through the unstained areas of Lugol's iodine we can take the biopsies directly. The cytology usually identifies the culprit but the this colposcopy locates the culprits. So when we do that means when we do a pap smear test, we can identify, okay, it has some lesions like CIN1 dysplasia or something. But in colposcope, we can easily identify which place is identifiable and we can take a biopsy from there.